This is a formal invitation for all dental professionals to join the Alberta Society of Dental Specialists at the Jasper Dental Conference to enter into a dialogue or a discussion at the Red Engine booth number 907 or participate in the discussion at www.dentforum.com. In terms of treatment planning in dentistry, dental implants have provided dentists and their patients with treatment options that basically were previously unavailable. That fact, combined with the fact that the placement of dental implants has become a highly predictable procedure, has sort of elevated dental implants to the point where they are now considered the treatment option of choice for almost any clinical scenario requiring the replacement of missing teeth. All of the above, so to speak, has resulted in a virtual explosion in the placement of dental implants, and basically speaking, some concerns should be raised about this. One of the concerns that I believe that dentistry needs to discuss further is the clinical scenario where dental implants have been placed in a partially edentulous patient, and then, let's say, what are the future implications of this 10, 15, 20 years down the road when that same patient, for example, now requires either orthodontic treatment or periodontal surgery. To give you an example, we give you a case in point where we have basically a 55-year-old gentleman who has had dental implants placed, or one placed roughly 10 to 15 years ago in this position here. The other restorations around the dental implants are crowns on natural teeth, and those crowns are breaking down. His chief complaint is oriented around replacing the fractured tooth in this quadrant. Again, the scenario is the dental implant is in place. We have to do further dentistry in this patient. It could involve orthodontic treatment. It could involve periodontal surgery. So again, the implant is in the place or position of tooth number 1-1. It's a long implant. It's a wide implant, about 5 millimeter diameter, roughly 13 millimeters. The rest of the restorations are failing around this implant. The study models for this patient, we can see some things in dentistry that we refer to as a deep overbite, occlusal plane problems, etc., lower mandibular crowding, supraerupted teeth, that under ordinary circumstances we would treatment plan around doing orthodontics to correct this problem before we do any prosthetic treatment. So how do we do the orthodontics when we've got a dental implant in this in place here, realizing that often the orthodontics involves moving the upper anterior teeth out in order to correct the overbite problem? In terms of a periodontal problem, and we want to do some surgical crown lengthening to increase the length of these anterior teeth to give the patient better tooth proportions and aesthetics, how do we do the surgical crown lengthening when the head of the implant is at about the position of the lines on the photograph. This creates a significant problem for us, and there are many cases that I see in my practice come in with this scenario. So this is a significant problem for dentistry, and again, we need to, as a profession, discuss how we're going to treat and plan around dental implants that are in place, or are we prepared to accept the scenario where dental implants are going to dictate the entire treatment plan for our future patients? In other words, in a tail wagging the dog syndrome.